I'm Angela Bradbury, and I will be sharing with you the GRACE program, a generative AI clinical chatbot to support APOE testing. This is in collaboration with Kevin Johnson in the School of Engineering and our colleagues at UNC. With results of the Clarity AD trial, amyloid-targeted therapies are now available for patients with Alzheimer's disease. A key component of clinical decision-making for treatment is a patient's APOE genotype. APOE testing has previously not been recommended in clinical care, given no clear clinical utility. But testing is now routine for patients considering amyloid-targeted therapies. While pre- and post-test counseling is recommended for clinical genetic testing, having every patient considering amyloid-targeted therapy meet with a genetic counselor for APOE testing is not feasible. Physicians caring for Alzheimer's disease patients will order testing, but many will not be prepared or have the time for the many questions that patients will have regarding the implications of their results, particularly the implications for relatives. To assist providers and patients in the setting of APOE testing for anti-amyloid therapy, the Penn Telegenetics and neurogenetics teams at Penn Medicine have adapted educational materials from the Generation studies and the eSmarter trial to develop a clinical chatbot for APOE testing in patients undergoing evaluation for amyloid-targeted therapy. Our current clinical chatbots are supported on the Penn Way to Health platform. Our educational chat is currently sent to patients at the time of APOE testing and covers the same content a genetic counselor would share with a patient. When APOE results are released, patients are sent a genotype-specific chatbot that covers the implications of their results for their own care and for their relatives. In both chats, patients can send in individual questions to be answered by the genetics team. In our initial clinical implementation and testing, the educational chat was launched to 600 patients who completed APOE testing. 21% of patients accessed the chat, and this was even higher among patients with 2 E4 alleles, where 1/3 accessed the chat. 1/3 of users who accessed the chat sent in individual questions, and 8 requested genetic counseling. Exit interviews with 22 patients endorse the value of additional education, that potential modifications might enhance engagement, and that sending result-specific chats closer to the time of result release would be valued. Our result-specific chats were available for implementation in December 2025, and we have seen even higher engagement, with 40% accessing the result chat and 50% of E4 homozygotes and heterozygotes accessing the chat. Patients who access the chats can send individual questions in through the Way to Health platform, and staff or genetic counselors can answer individual questions. Most of the questions to date have been related to APOE results and frequently the implications for relatives. The Way to Health platform has developed a baseline automated response system using LLMs, prompt engineering, and a set of frequently answered questions developed by our team. Given the risk of hallucinations and uncertainty of the quality of the responses, a team member has to first review these and consider any edits prior to releasing responses to patients. With this pilot grant, we seek to develop better methods for trustworthy, automated, generative AI responses to patients' questions in the clinical chatbots. We will be using a unique resource of over 2,600 recorded genetic counseling sessions where genetic counselors disclose APOE results to patients across the U.S. in our related genetic delivery studies. We propose that this resource will provide real-world questions from patients and answers from certified genetic counselors to provide clinically accurate and patient-centered automated responses to individual questions sent to the clinical team through the chats. In a preliminary proof of concept project, Dr. Johnson's team has leveraged an open source LLM to retrieve and summarize relevant information from 40 recorded APOE sessions. This is used as a wrapper for a closed source LLM to answer individual patient questions. The intent of this project was to enable LLMs to generate medical text that retains both content integrity and clinical stylistic integrity. We conducted a human evaluation where 25 patients reviewed blinded GC-generated and computer-generated responses and rated them for trust, coherence, and relevance. Responses revealed that the AI or computer-generated responses were equally favored, supporting the benefit of further developing these methods in this study. To develop our trustworthy automated generative AI responses, we will explore 2 open source LLM frameworks and use transfer learning and optimize the model using the bank of recorded sessions and RAG to direct each model's output from the domain knowledge provided, as well as few-shot learning for optimization. We will review the performance of these models with genetic counselors and get their feedback to consider refinements to optimize accuracy, clarity, and acceptability of responses for release to patients. In AIM-2, we will evaluate both of these methods, the baseline way to health method and our new generative AI method, to evaluate automation and the ability to reduce genetic counselor time. In the first 6 months, we'll evaluate the current automated response approach and way to health. Outcomes will include the number of queries generated, the number of responses appropriate for release to patients, the number of responses requiring edits, genetic counselor time in generating edits, and the number of patients who request formal genetic counseling. In months 7 through 12, we will evaluate the new generative AI method to automated responses, and will evaluate the same outcomes. We propose that our APOE testing chatbot program can be scaled to support real-world patients undergoing APOE testing for amyloid-targeted therapy for Alzheimer's disease across the U.S. Additionally, the generative AI methods and enhancements developed in this proposal will increase the reach of the program by reducing provider time and will be broadly applicable to multiple emerging areas in precision medicine and clinical care. Further, given opportunities to disseminate and refine our tools through the National Penn Telegenetics program and community clinical settings, these tools will be applicable and designed for diverse real-world patients of varying health literacy and community practices in the U.S.